Hello, I'm Anthony Zietman. I'm the Professor of Radiation Oncology from the Massachusetts General Hospital in Boston, Massachusetts. I'm going to talk to you today about the management of high-risk prostate cancer. Many years ago, approximately 20 years ago, radiation was considered the only way to treat this disease. And radiation oncologists have spent a lot of time developing randomized trials in which they've shown that higher dose radiation is more effective than conventional dose radiation. They've shown that adding hormone therapy is more effective than using radiation alone, and that longer courses of radiation are more effective than shorter courses. So there's a lot of evidence supporting the use of long-term hormone therapy and high-dose radiation for high-risk prostate cancer. In recent years, surgeons have started to visit this space, and prostatectomies are now being performed for men with high-risk prostate cancer. I actually think this is very reasonable. Patients have to understand that it is likely that surgery will only represent the first step in the management of their disease, and they're probably going to need radiation and/or hormone therapy afterwards in addition. So a radiation-based approach or a surgery-based approach are essentially multimodality approaches. And the patient must be aware of this. That is what's required to eradicate their cancer, if that is possible. Now, there are advantages to starting with radiation. The advantage to starting with radiation is firstly that you avoid surgery, and for many patients that will be considered an advantage. The second advantage is a patient will come to systemic therapy early. And of course, many of these patients do have occult micrometastatic disease, and so that's probably appropriate. The principal advantage of surgery is that occasionally surgery is the only treatment that that patient will require, in which case they get to avoid hormone therapy, or at least defer hormone therapy. And for many patients, that will be attractive as well. So I think we do now have a choice of approaches for our patients. Younger patients these days tend to choose surgery. Older patients tend to choose radiation, and I think that's just fine. Those patients who are in the middle, those in their 60s, really have a choice. So I do think the outcomes for high-risk disease are improving because we're using multimodality therapy, and we can now introduce the patient's voice into treatment selection. Thank you.